Have you ever stopped to think about what's actually going through your veins right now? Most of us don't. We just assume that as long as our hearts are beating, everything's fine. But here's the truth. What's moving through your bloodstream determines how healthy your heart really is. One of the biggest hidden threats to that flow is something called high cholesterol. It doesn't cause pain, it doesn't make noise, and you won't feel it building up. But silently, it can begin clogging the very arteries that kept you alive. The good news is it's not something to fear, it's something to understand and to manage. Because once you know your numbers and what they mean, you can take control of your health and protect your heart before problems even start. In simple terms, cholesterol is a fat-like substance made by your liver and also found in certain foods like meat, eggs, cheese, and fried foods. Your body actually needs cholesterol to build cells and make hormones, but too much cholesterol in your blood can lead to fatty buildup in your arteries. This buildup, called plaque, makes it harder for blood to flow. Over time, that increases your risk for strokes, heart attacks, or peripheral artery disease, also known as PAD. In simple terms, cholesterol isn't bad itself, but when the levels rise too high, it begins to clog your blood vessels, much like grease clogging a drain. Now, let's look at the different types of cholesterols. We have LDL, which is considered the bad cholesterol. This cholesterol carries fat from your liver into your arteries. Too much leads to plaque buildup. And then we have the HDLs. This is considered your good cholesterol. It cleans the arteries by carrying extra fat back to the liver for removal. Then we have triglycerides, which store the fat. It carries extra calories that are stored by your body fat, and excessive intake can raise your risk of heart disease. Let's talk about your numbers. Your total cholesterol should be below 200. Anything between 200 and 239 is considered borderline, and anything above 239 is considered high. And then we have the LDL, which is your bad cholesterol. It should be below 100. Anything over 130 is considered high. And then we have the HDL, which is the good cholesterol. This number should be above 40 in men and above 50 in women. Anything below 40 is too low. And then we have the triglycerides. These numbers should be below 150. Anything above 150 is high. Let's talk about the causes of high cholesterol. Eating too many fried or fatty foods, lack of exercise or prolonged sitting, a sedentary lifestyle. Obesity, especially around the waist. Smoking or excessive alcohol. And then genetics. They play a big role. Family history of high cholesterol or even heart disease. Certain health conditions such as diabetes, thyroid problems, or kidney disease also can cause high cholesterol. Now, high cholesterol usually has no obvious symptoms. It's a silent condition. Most people don't even know they have it until they have a blood test or a heart-related issue. That's why regular screening is so important. Typically once a year or more, often if you have any risk factors. The good news is, even if your cholesterol is high, there's a lot you can do to bring it down. Let's start with your lifestyle, because that's always the first line of defense. Eating heart-healthy foods, such as fruits, vegetables, whole grains, and lean meats. Using healthy oils like olive oil or avocado oil instead of butter or shortening. Exercise at least 30 minutes most days of the week. Maintain a healthy weight. Even losing weight can improve cholesterol and your blood pressure. Quit smoking and limit your alcohol intake or discontinue it altogether. Smoking lowers the HDL, the good cholesterol, and too much alcohol raises your triglycerides and damages the liver. And manage your stress. Stress hormones can raise cholesterol and your blood pressure. Try prayer, meditation, or deep breathing to calm the body. Sometimes, even after you've changed your diet and exercise, your numbers may still be high. That's when medication may be needed to give your heart a little extra help. Medications such as statins, like Lipitor or Crestor, these lower your LDL and prevent plaque buildup. And then we have Zadia. It reduces cholesterol absorption from food. Fibrates or omega-3s. These lower your triglycerols. Your healthcare provider will decide what combination works best based on your risk factors and other health conditions. Once your treatment plan is in place, especially if you're taking medications, the next step is keeping an eye on your progress. Also, with statins, they sometimes can cause side effects. So make sure you report those to your healthcare provider. And some of the common side effects of statins is muscle pain or soreness, headaches, nausea or indigestion, fatigue or weakness, mild increase in liver enzymes. So that's why it's very important that if you're ever started on a statin, that you follow up with your healthcare provider at least every 3 months, no longer than a year. And severe side effects that you need to report immediately are severe muscle pain, tenderness or weakness, dark colored urine or decreased urine output, yellowing of the skin or the eyes. This is called jaundice, unexplained fatigue or loss of appetite, memory problems or confusion. Now, these are rare, but they must be reported. Knowing your cholesterol is wisdom in action. Taking steps today, eating better, moving more, praying for strength, keeps your heart strong and your future secure. When was the last time you did a cholesterol test? What's one small change you can start doing this week? Maybe using olive oil, walking daily, or skipping fried foods, because every heartbeat is a blessing worth protecting. Please like, share, and subscribe to this YouTube channel. And also, you can enter your comments in the video description. If you have any questions about high cholesterol, you can leave a comment and I'll answer it, or you can email me. You can also put in the comment section anything you would like for me to discuss on the next video.